Greetings from Washington, D.C. This is Peter Thomas, the General Counsel of NAAOP. Well, I'm back in Washington and COVID-free. Very pleased to announce that I tested negative for the antigen and positive for the antibody, which I understand affords me some degree of protection going forward, but not a whole lot. They really don't know what the effect of the antibody is and how long it might last or protect a person. I've been counseled by my physician, just so you know, to continue to wear a mask like everyone else, and will continue to do so. My sister, who also had the virus, who I mentioned in my last video, has now recovered fully. I'm recovered fully, and we're really back on track. I wanted to take a moment to thank so many people in the O&P community for their heartfelt expressions of sympathy on the passage of my parents. The love and support that I felt and received from all of you was really overwhelming and touched me deeply. And I want to thank you all for doing that. I can't express enough gratitude for what I received during that difficult time. So having said that, I want to move on to an important statement that the NAAOP wishes to read. And say, if you go to our website, you'll also see it. This statement follows the events of George Floyd and the aftermath of that racist activity. The NAAOP is proud to stand alongside our sister organizations in the O&P profession in signing and supporting the statement. As a result of recent events in our country, we want to all members of the O&P community to know that your O&P professional organizations stand together against racism. We are steadfast in our commitment to fairness, justice, and respect for all. We remain dedicated to open dialogue, active listening, and working toward enhancing diversity at all levels of our profession. And this statement is signed by 6 organizations, including NAAOP, the ABC, BOC, the Academy, or AAOP, AOPA, and NCOPE. It's an incredibly important statement to make, although, let's be honest, it's unfortunate that it even has to be said. It truly is a situation where we wanted to be on record above all. But this is a very horrific situation that everyone is dealing with now on this issue, and at the very least, we wanted to commit to writing and reaffirm our commitment for fairness, justice, and respect for all. Let me move on to the policy agenda, because there is plenty happening in Washington, D.C. in the wake of both COVID-19 and the civil unrest that we've seen over the last several weeks. First off, as most people know, the prior authorization program for 6 prosthetic codes was in fact delayed. It was supposed to occur and begin as a pilot in 4 different states, California, Texas, Michigan, and Pennsylvania, on May 11th. The O&P community, but in particular NAAOP, really opposed moving forward with that during the COVID-19 crisis, because we felt that a new documentation regimen for prosthetic care would harm patients. It would make it much more difficult to obtain care that is needed by people with limb loss. And so we opposed moving forward with that prior authorization pilot at this time. Fortunately, CMS agreed with us and postponed the pilot. We don't know exactly when prior authorization will go back into effect or go into effect, but we will keep you in touch as soon as we learn more. Next, I wanted to bring you up to date with the 2 programs that we've talked about in the past for fiscal relief for O&P practitioners in the wake of COVID-19. One is the Medicare advanced payments. There was a total of $175 billion funded to provided to the Provider Relief Fund, and about $90 billion of that has now been distributed. They're expecting to distribute more in the coming weeks based on need. And we're well aware that the O&P practitioners who submitted Medicare claims in the previous year were recipients of some of those funds. And so we'll continue to keep people up to date with how that program is going. Next is the Paycheck Protection Program. And that is a program that is funded but with over $600 billion of federal funding to assist small businesses defined as 500 employees or less. This is a program that we've got some news to share. The president just signed today a bill that would amend some of the provisions of the Paycheck Protection Program, make some of the terms a bit more flexible, and allow that program to continue to meet the needs of small businesses. In particular, the loans are postponed from a 2-year payback period to a 5-year payback period. If in fact the loan does not qualify for complete forgiveness, the percentage that must be spent on paychecks or salary and benefits is reduced from 75% of the funds received down to 60%. So the funds can be used on additional expenses, which is a very helpful provision, and the funds can be spent over a longer period of time than just 8 weeks. So it's a good program. If you haven't applied, there still are funds available in the program. We encourage you to do so to try to bridge the gap during this difficult economic time. Finally, I wanted to mention NAOP's and the O&P Alliance's joint efforts on telemedicine. It's pretty clear that there are instances that where telemedicine could be useful in the O&P profession and in the provision of orthotic and prosthetic care, in particular to triage the severity of particular problems that patients might be enduring without making them go to and see in person a prosthetist or orthotist. Problem is getting reimbursed for those activities. We are working with CMS along with our alliance partners to try to move that issue forward. And we wanted to make sure that people were aware of that. There'll be more information on that coming in the future. So with that, let me just reiterate my thanks, my personal thanks to the O&P community and to the members of NAOP who have been so wonderful to me over the last 5 weeks. And we look forward to our next update. Thank you very much.